talk about the BBL recovery. Dr. Nikko, walk me through, when can patients wear jeans after surgery?
Great question, Stephanie. I think recovery, how long it takes, it's not a simple question to answer because it means a lot of different things to everybody. Some people, they may ask, well, what does that mean? When can I work out? Some people say, when can I go back to work? Some people like, when can I go on vacation? When do I look perfect? So it means something different to everyone. That's why I take time to answer that question. And let me take some time now. Well, in terms of how long it takes, it depends a lot of how much we do. Do you have stubborn fat in your stomach area? How much fat do you have back here? How much liposuction really do I have to do? Because it's not really the fat injection that it's slowing you down. It's really the liposuction. Why? Because when we do the lipo 720, we're taking the deep layer of the fat, we're taking the superficial layer of the fat, not the subcutaneous layer again. And when you remove that much fat, I mean, your body has to go through some recovery process. I tell patients, for a couple of weeks, you are gonna feel really tight down there. You are gonna feel like some stiffness in the back area. So I tell people in general, you really have to kind of hang it in there for a couple of weeks. Now, does that mean you have to take?
What about when you can say go back to work?
Yeah, great question. So patient will look at me like, I can't take that much time off work. You don't have to. Now, I really tell patients this. When you go back to work, obviously the main thing they worry about is sitting down, sitting on the fat. Well, we teach people how to sit because really if you're sitting down, I don't know if you can see on camera, but you're really sitting, we teach people during the first week to sit on their thighs and kind of lean forward. They're not really putting pressure in their buttocks, okay? So that's not really an issue. I tell patients that you really don't want to take more than a week off because laying around all day long at home doesn't really help because when you're laying down, all that edema, all that swelling kind of settles down. So I encourage people to actually move around. But they're like, Dr. Nikko, I was told not to move around too much because you kill the fat. Not really. I mean, you're not exercising, you're moving around, you're walking around. You're not going to kill the fat. The fat cell is going to stay where it needs to stay. It's going to do its own thing. You don't need to really worry about that as long as you're not vigorously working out, right? So I encourage people to kind of go back and do their normal things. You know, after a week, take a walk around the grocery store, go to the mall, go to work, sit. I mean, move around. It helps.
Well, what really helps is when you wear a garment.
Yeah.
So what about a garment, Dr. Nikko? How often do you have to wear the garment and for how long?
Okay, so talking about the garment, the reason why Stephanie brought it up is garments are very, very important because they use it a lot, obviously, in South America where they do a lot of BBL. So they figure out that garment is key, you know, because after we reshape your body, you got to wear a garment to kind of help continue to reshape that. Now, luckily, these garments that they make now are obviously in South America. I mean, it's just as hot as Houston, right? So, if people are like, "Oh, I can't do this during the summer. I can't imagine wearing a garment like that, and it's so hot in Houston." Well, luckily, they make garments that are, you know, that's very and friendly that you can actually wear underneath your work clothes. They make it very, very nice. We use two types of garment. One for the first week, we put it on you right after surgery. We take that off and we switch you to something that you can wear definitely to work and to your normal everyday thing. Now, just back to the recovery. So, when after 2 weeks, when can I work out? Typically 2 weeks, and when I tell people you can go back and do light stuff, really after 2 weeks, I tell patients, look, you can do whatever you want as long as you can tolerate it. Does that mean people are going to go around and run around? No, they're not going to do that. You know, there's a lot of CrossFitters, a lot of people. It depends on what kind of activities you're talking about. But 2 weeks, I just tell patients go back and try to do what you normally do. You're not going to be able to do it all, but at least start trying, and you'll get back to it slowly. If they have a vacation plan, I say, you know what, you typically want to wait 6 to 8 weeks for that, for your body to heal. 6 to 8 weeks out, you're about 80% there.
Wow.
After the last...
Think about that, though. I mean, you could work out for the next 5 years of your life and try to really work out that hard. But when you actually do the liposuction BBL, you're taking that fat, you're contouring your body 6 weeks. That's amazing.
Yeah, it is amazing. It's as amazing it is. You're removing the stubborn fat that it's very hard for a lot of patients to remove, you know, after, especially having kids. And we have a lot of people who work out a lot and still got a little stubborn fat. And so now all they need to do is maintain it.
That's amazing. Wow. Thank you, Dr. Nikko. I did not know it was going to be that easy. 2 weeks, you can go back to work.
Yeah, but again,
working out.
Yeah, but again, I tell people full recovery though, it's 6 months. Not 6 months like to feel completely normal, but like you're 80% there. But again, your body has to go through certain changes, and that takes about 6 months with any surgical procedure in the body, lipo, tummy tuck, anything you do.
Right. Well, what's great too is we take a lot of pride in our aftercare. So we will see you a couple days post-surgery, we'll see you a week post-surgery, 2 weeks, a month, 3 months, 6 months, 9 months. We really do care about our patients and walking you through the whole process. So
Yeah, the post-op period is so vital, so important. I mean, do you have more swelling than other people? Where is the swelling? Do you need lymphatic massage? Do you need me to help you with certain? Do you need treatment with our cellulotone that uses sound wave? Do you need a little bit of this? So you can't just do liposuction and expect the patient to go out there and just kind of like they're on their own. There's a lot of aftercare that goes into it. The procedure is just the beginning.
it's true. Wow. Well, thank you, Dr. Nikko. And if you have any more interest in learning more about a BBL or liposuction, make sure you check out our website, drnikko.com, or even subscribe below and follow us and watch a couple more of our videos. Stay tuned. Thank
Thanks.
you.